Let's talk about pain at the level of the vocal folds. It's really important to understand that there are no nerve endings on the vocal folds. That means you actually can't feel anything on the vocal folds. So when you're really vocally fatigued, or maybe you've been sick and you've been coughing and your throat hurts where you've been coughing, it's actually not the vocal folds that hurt. It's actually the muscles around the vocal folds that are sore and inflamed. This is a really important thing to understand when we are measuring our level of vocal fatigue. If you're at the point where it hurts to speak or sing, then that actually means that the muscles around your vocal folds are hurting. And if those are hurting, there's a good chance that your vocal folds themselves are also pretty inflamed. Now, this is pretty common when a person has a cough. If you think about what a cough is, it's really the slamming together of the vocal folds. That's pretty traumatic for the vocal folds themselves. So over time, after a day or two of being sick, most people find themselves going hoarse. And even if they're not hoarse, often people will get a sore throat around the area where their vocal folds are because those muscles are taking a beating, really. So if you're at the point where your voice hurts in any way, whether it's because you've been sick or maybe because you've just overdone it vocally, you should stop singing. Singing on swollen vocal folds is generally not a good idea. It increases the risk of injury, which we'll talk about in a later video. And so it's best in that condition to just take it easy as much as possible. Remember, with no nerve endings on the vocal folds, we often aren't going to feel any pain until it's at the point where it's pretty bad. Now, a lot of people, when they do have sore throats, will go for products that have numbing effects. I'm talking about like menthol cough drops, those sprays that you can spray into the back of your throat, etc. These can have really soothing effects, but they are actually pretty dangerous for voice users. The reason is that they are numbing. We already can't feel the vocal folds. When we can feel pain, it's an indication that the muscles around the vocal folds are swollen, which doesn't really bode well for the vocal folds themselves. What these numbing products do is really give us a false sense of confidence that we are in a healthier condition than we are because we're not feeling any pain or discomfort. So if you're going to numb, then you're actually preventing yourself from receiving signals of injury. The body uses pain to let us know when something's wrong. So if we can't feel, then we're not going to be getting those really important signals that the body is giving us to maybe tell us to stop or take it easy. And this can increase our risk of injury. So if you do want to take a cough drop or some sort of soothing lozenge, the Ricola ones are usually a better option because they don't have numbing properties, or any other product that you find that is not going to create that numbing effect in the throat. That being said, many people may be surprised to learn that you actually sometimes can sing when you're sick. There are a couple important factors here. If you have a cough, you shouldn't sing. We already talked about this, that the cough is going to cause heavy impact on the vocal folds, and that's probably going to lead to inflammation. You should really just take it easy. But if you have a cold or a sinus infection or something that is above the level of the vocal folds and doesn't deal with the lungs or the vocal folds themselves, then you actually may be in okay condition to sing. It's going to feel a little weird because there's congestion, and that's probably going to affect the way that you perceive your resonance. However, apart from a postnasal drip and that discomfort in the head area, those infections usually don't actually affect the vocal folds themselves. I have a friend who in college sang her entire hour-long senior recital, super sick, and the audience had no idea until she started to thank them afterward, and we could hear that there was congestion. So it's completely possible to sing, but it's really important to listen to your body. If it hurts, if it's uncomfortable, stop. If you don't have to, it's probably better not to risk it, but if you're in a pinch and you can gently test out your voice and you're finding that it's working okay, then it may actually not be detrimental to you. In the next video, we're going to be talking about smoking and vaping and the impact on the voice. Until next time, see you later.